Good day to all of you. Today, we will move on to another new lecture that is on vomiting. I know that the name is not so nice, but anyhow, we have to learn about the physiological aspect of vomiting. I'm very sure that all of us have experienced episodes of vomiting in our life. So, why we are going to learn about vomiting and what is the importance of learning the physiological aspect of vomiting. At the end of this lecture, you will realize why we are going to learn about this physiological aspect of vomiting. Now, as you all know, as many other reflexes which we have learned so far in gastrointestinal tract, vomiting is also a neuromuscular reflex. So, simply saying, it is the mechanism by which the upper gastrointestinal tract rids itself of its contents. So, if you say it is the reverse phenomenon of swallowing mechanism. Now, you know, when you are talking about swallowing, you are propelling your footballers to your stomach. So, in contrast to swallowing, vomiting is going to remove or to take out most of the upper gastrointestinal contents from its place out of mouth. So that is the reverse phenomenon of swallowing. That is clear. And then, now I told you, this is a reflex. So any reflex mainly consists of three main structures. The first one is sensory organs. Then you have the main controlling center, most probably within your brain or the brain stem. And you have the effector organs. And how we are going to coordinate between these three structures, you have two sets of wires. So what are these wires? Afferent nerve set of fibers and the efferent nerve set of fibers. So these are the two connecting mechanisms of these three structures: sensory organs, central coordinating center, and the effector organ. So as with this vomiting reflex also, you have the sensory organs, okay, because this is a reflex now, and you have the central coordinating center. That is a specific central coordinating center. As you have learned about swallowing, you have a swallowing center. Like that, for this vomiting reflex also, you have a separate coordinating center in your brain stem. That is known as vomiting center. Now we'll go one by one. What are the sensory organs? So sensory organs, there are mainly one type that is related to your GI tract, right? Like pharynx, your esophagus, stomach, and upper parts of the small intestine. So in either one of them is going to be stimulated due to any irritating or toxic substance, either pharynx, esophagus, stomach, or upper GI tract, upper small intestine. You will initiate vomiting. And other than that, not only GI related sensory organs, we have non-GI related sensory organs as well, such as chemoreceptor trigger zone, you have the vestibular apparatus, and higher cortical centers. What are those? What are these chemoreceptor trigger zone? What is this vestibular apparatus? We will see. Right. So then I told you, there are sets of wires which will connect all these structures. Now, from the sensory organs, if they are being stimulated by any kind of toxic substance or an irritating stimulus, what will happen? They will be stimulated and they will send signals to our vomiting center. So, stimuli of GI tract, I'm mainly talking about the GI tract. They will be sent via vagus nerve and sympathetic afferent nerve fibers. So these are the major things which will take signals from the GI related stimuli to our vomiting center. That is the vagus nerve as well as the sympathetic afferent nerve fibers. Then we are going and we are giving these signals to our vomiting center, which is the main coordinating center of the vomiting reflex. That is in your brain stem. What is where in the brain stem? It is located in the dorsal portion of the lateral reticular formation in the medulla oblongata in the brainstem. So you can see these marked in pink color, roundish structures. You can see the vomiting center that is in the medulla oblongata. So you can see from the green arrows, some stimuli coming from another two structures known as chemoreceptor trigger zone. You can see them marked here. So I told you another sensory organ related to vomiting is chemoreceptor trigger zone. So here also you can see nicely vomiting center being stimulated by the chemoreceptor trigger zone as well. Right. Then now we have marked the vomiting center here in red circle. So you can clearly see that. Okay. So it's clear now vomiting center will be activated by different types of stimuli from different areas. So the sensory organs I told you, upper GI tract and the pharynx, the esophagus, everything. And then from the chemoreceptor trigger zone, and then vestibular apparatus, lastly from the higher cortical centers. So these are the 4 areas which will come and stimulate the vomiting center, right? So this is a small diagrammatic representation for the stimuli of vomiting center. From this one, you can nicely understand that your vestibular apparatus, your higher cortical centers, as well as GI tract and the chemoreceptor trigger zone will stimulate the vomiting center. So it coordinates the respiratory, gastrointestinal and abdominal muscles, right? Vomiting center. Because respiratory muscles, gastrointestinal muscles and abdominal muscles all are involved in the vomiting process. So it controls the final common pathway that mediates the vomiting from all the causes. Okay. So now what will happen now? Vomiting center will coordinate everything, all the stimulations from all the sensory organs, and it will cause the actual vomiting. So you know that actual vomiting should be happen at the end by your GI tract. Okay. So it is now transmitted to the effector organs via the efferent nerves. So who are the efferent nerves? Now by looking at this slide, you can understand there are 3 sets of efferent nerves. First one is cranial nerves, like in your swallowing reflex, you have 5, 7, 9, 10, 12. So there are 5 cranial nerves, 5, 7, 9, 10, and 12. And you have vagal and sympathetic nerves as well as your spinal nerve. So these are the 3 sets of efferent nerves. Okay. So you have 3 effect organs as well. So what are these effect organs related to GI tract? Upper GI tract, lower GI tract, and your diaphragm and abdominal wall muscles. So these effect organs, you can remember in 3 sets. Upper GI tract is one group. The other one is the lower GI tract. The last one is the diaphragm and the abdominal wall muscles. Why I'm saying you have to remember these 3 structures in 3 groups? Because all these 3 groups will be supplied by 3 different sets of effector nerves, efferent nerves. Now, I told you there are 3 sets, as I showed you earlier also. Cranial nerves, there are 5, 5th cranial nerve, 7, 9, 10, and 12. So, these cranial nerves will supply the upper GI tract. And lower GI tract will be stimulated by the vagal and the sympathetic nerves. And then, your spinal nerves will go and stimulate the diaphragm and your abdominal wall muscles. All right. Okay. So now we are ready with the vomiting reflex. Now we have learned about the sensory organs, GI related and non-GI related. There are mainly 4 types we learned. And we learned the afferent nerves, vagus and the sympathetic nerve. Then we learned about the major controlling center of the vomiting, that is the vomiting center located in the medulla. And we just saw where the chemoreceptor trigger zone is there. And we learned the efferent nerve. There are 3 sets of efferent nerves which are going and stimulating 3 structures, groups of effector organs, upper GIT, lower GIT, as well as abdominal wall muscles and diaphragm. All right. Now we are ready to learn the vomiting act. Now, once the vomiting center is stimulated sufficiently, now vomiting act is started. So what are the effects? First, we take a deep breath like that. Then with that, you are raising your hyoid bone and larynx to pull the upper esophageal sphincter to be open. Now we have to open up the upper esophageal sphincter first, okay? And with the meantime, you have to close your glottis. Why? You have to prevent the footballers entering into your laryngeal area. That means your trachea and, to your bronchial tube and also to your lungs, you have to prevent. Therefore, you have to close your glottis. So you have raised your hyoid bone and the larynx, and you are closing the footballers, the pathway which will enter to the lungs. And then you have to lift the soft palate to close the posterior nares. With that, you can understand there is a similarity with the mechanisms which occur usually with the swallowing process. Is it clear? Okay. Then what will happen? There is strong downward contraction of the diaphragm. At the same time, with this contraction of the diaphragm, what will happen? Your abdominal wall muscles also will be contracted, okay, with the help of the spinal nerves. Then these things will happen within fraction of a second, okay? This will not take hours and hours. This will be very coordinated mechanisms. This squeezes with the increased intra-abdominal pressure and the diaphragm pushing downwards. It will squeeze the stomach between the diaphragm and the abdominal wall muscles, and intragastric pressure will be raised. So what will happen? Now only your lower esophageal sphincter will be relaxed completely, because with the increased intragastric pressure. So it allows expulsion of the gastric contents out, upward into the esophagus, out of the stomach. Okay. So simply saying, now this is a summary of the vomiting act, which I have so far described. First, you take a deep breath and your hyoid bone is moved upward and your larynx will be moved upward. With that, simultaneously, your glottis will be closed and then your soft palate will be raised to close the posterior nares. And for a meantime, for a little time, you will suspend your breathing. You will hold your breathing. And contraction of the diaphragm and the abdominal wall muscles will push and they will squeeze the stomach, which will increase the intragastric pressure. And you will eject the gastric contents out to the esophagus, because you are going to relax the lower esophageal sphincter completely. And then you put your gastric contents out, right? So this is repeated until you are removing your stimulation, right, from your body. You will repeat this cycle, repeat over and over again. Okay. So now it's clear. Now you have learned the whole vomiting process, vomiting reflex. So as a whole, vomiting can be divided into three main phases. Okay. Nausea, retching, and vomiting. So remember, nausea is often actually a prodrome of vomiting. That is actually a signal that you are about to vomit. It is actually unpleasant sensation that one may soon vomit. Then retching means something like activities, muscular activity of the abdomen, thorax, which are voluntary, right? So you are having some kind of a forced inspiration against closed mouth and glottis without oral discharge of gastric contents. And then you are going to vomit. That means you are forcefully expelling gastrointestinal contents out of the mouth. All three can occur together or independently. Remember that. That means somebody might have nausea only, but don't have retching and vomiting. Some might have no nausea, but directly vomiting. Some will not have vomiting or nausea, only retching. That means they are independent totally, or else may occur as together. Understood? Right. Now, we learned about the stimuli of vomiting center. Now we learned GI stimuli will be there. We have chemoreceptor triggers on, vestibular apparatus, and higher cortical centers. Right? Now we will look at briefly what is the role of chemoreceptor triggers on. What is this with regard to vomiting action? Now we learned about the process, what are the different afferent nerves involved. Now we have done that. Now we will look at side things, right, which are important with the vomiting reflex. Now chemoreceptor trigger zone is located in the area postrema. Okay, now here this is the location. That is actually a V-shaped band. If you take In one aspect, if you look at that, it is a V-shaped band of tissue located bilaterally on the floor of the fourth. Now we are at the floor of the fourth ventricle in the medulla oblongata. You can see that. Okay. So I have circled it here. Then it is situated, that's the most important part. It is situated outside the blood-brain barrier and it contains fenestrated venules. So it is exposed to both blood as well as cerebrospinal fluid because it is outside the blood-brain barrier. So it can react directly to substances in the blood and the CSF. Okay. So who are going to stimulate the chemoreceptor triggers on? Either drugs like opioid, morphine, apomorphine can stimulate, cardiac glycosides, chemotherapy, radiotherapy, uremia, hormones, hepatotoxins, lots of things. Especially you can see from this list, most of the drugs, okay, they are going to stimulate the chemoreceptor triggers on. Okay. So the next one, next stimulating sensory organ, that is the vestibular apparatus that is located in your ear. So if you have any kind of disturbance in your vestibular apparatus, that stimulates the cranial nerve, that is the vestibulocochlear nerve or the eighth cranial nerve. So it stimulates the vomiting center, which will lead to motion sickness. Motion means something to do with movement. Okay, so from the picture you can understand. Maybe most of you, right? The viewers, I think, I'm sure that at least one time in your life, you may have experienced this kind of a motion sickness while you are traveling in a bus or a car, or else by traveling while you are traveling in planes, aeroplanes, okay, ships, you may have experience due to rotation, right? Due to movement of your body. Prior to identification of the role of vestibular system for this motion sickness, there were many theories. So like gut shift theory, circulatory system disturbance theory, like that, there were many theories. Okay. But later found that nothing is related to no gut shift theory, no any circulatory system disturbance. Here mainly it is primarily due to disturbance of the sense of orientation in space. Okay. So you have any problem in the orientation, space orientation, usually why this sense of orientation is disturbed? Because it is due to inflow of conflicting impulses from different receptors, in particular the inner ear and the eye. Because your eyes, they are also sending signals and your ear also sending signals. So there are some kind of conflicting impulses while you are traveling. Okay. So then this is due to those sense of orientation in space. Those disturbances will ultimately lead to motion sickness. So that means motion stimulates receptors in the vestibular labyrinth of the inner ear. Okay, that is the semicircular canals. Then vestibular nuclei. Some nuclei groups are there. They are known as vestibular nuclei in your brainstem. And from that, you will send signals to the cerebellum. From the cerebellum to the vomiting center. All right. Okay. So then higher cortical centers, the last one, last sensory organ, that means vomiting center will get input from the higher cortical centers as well. Like if you are in severe pain, okay, after surgery or like that, and before examination, before surgery, sometimes you have fear, anticipation, and seeing something, sight, a very distressful conditions. If you visualize, all these things can cause vomiting, but it is very subjective. Okay, it depends on person to person, that personality. So these higher cortical centers are also directly stimulating the vomiting center. Okay, right. So when you are learning about the vomiting process, you have to have an idea what are the receptors and neurotransmitters which are involved in vomiting process. Now, when you are looking at this slide, you can see in the chemoreceptor trigger zone, there are different types of receptors with related to the higher centers. Now, higher cortical centers, you have GABA. GABA is the major neurotransmitter, histamine type 1. Those receptors are different. Okay. And when you are talking about the motion sickness or the vestibular apparatus, you have different, like histamine type 1, H1 receptor, and acetylcholine muscarinic receptors are there. Okay. So what is the relevance? What is the importance of learning different types of receptors and neurotransmitters involved in different occasions? Because then when you are deciding the management, treatment, right, then it will differ. So you can understand what I am saying. Now, if you are talking about motion sickness, the drug which will inhibit or stop the vomiting, which was caused by motion sickness, is not applicable to vomiting caused by the other causes. Okay, because they are neurotransmitters and their receptors are different. Can you understand? So I think if you have time, please go through leisurely, and if you can refer many textbooks, you can get an idea, especially pharmacological aspect of the vomiting as well. Then you can get a thorough idea of the receptors and neurotransmitters which are involved in vomiting. Okay, right. Now we will move on to a little bit of clinical aspect of vomiting as well. Now, if you have experienced vomiting, you may have noticed in different scenario, different conditions, you will have different colors in vomiters. So is this important? Yes, of course. In clinical context, it is very important. Now, if you have non-bloody, non-bilious, bilious means not related to your biliary secretions, okay? Usually clear, normal, day-to-day life, our vomiting, normal vomiters, usually it is yellowish, maybe clear, lot of fluid will be there, with remnants of previously ingested food. That is the most types of vomiting. That is okay, right? You can manage it. And then hematemesis, that is another type. That is blood in vomiters, somewhat serious. Fresh blood, okay? So the next one is coffee ground vomiting. That means your vomiters contains altered blood. That is resembling to coffee ground, okay? Then bilious vomiting. Bile in the vomiters. It is giving a greenish color. Bile is usually greenish, no? So it is giving a greenish color to your vomiters. It enters the vomiters during subsequent heaves due to duodenal contractions, if the vomiting is so severe, okay? And then the most devastating one, that is the fecal vomiting. If you have consequences, if you have any problems of intestinal obstruction, or else due to gastrocolic fistula, there's a fistula or internal connection between your stomach and the colon, you may have fecal vomiters, okay? So hematemesis, I told you it is a very distressing one. You have fresh blood in the vomiters. Can be either due to a ruptured peptic ulcer, malarialized tear of the esophagus. What is this malarialized tear? If you have repeated bouts of vomiting, right? So it will traumatize your esophagus. That tear will be known as malarialized tear. Okay? And what is coffee ground vomiting? That is actually altered blood which bears resemblance to coffee grounds, because iron in the blood is going to be oxidized due to old upper GI bleeding, maybe, or else due to lower GI bleeding, which has to come through the stomach. Okay, that is known as coffee ground vomiting. And then that is the clinical aspect of vomiting. So what are the causes of vomiting? Different types of causes will be there, like due to metastasis, okay, meningeal irritation, due to motion or movement, anxiety, medications, microbes, organisms, okay. The commonest cause is microbial action due to viral or bacterial causes, and motility problems, either due to intestinal obstruction, mechanical obstruction, or you know that in myocardial infarction also, you will have vomiting sometimes, okay. Right. Now we have done. We know the normal process of vomiting. It is a reflex. What are the components of this reflex? And we know the clinical applications, the color, how it depends according to the cause of vomiting. We learned a few causes of vomiting, common causes. Now we will see what are the complications of excessive vomiting. The most important thing is dehydration, which will lead to hypervolemic shock if we are not going to treat accordingly. And then there would be metabolic derangements like acid-base derangements or electrolyte derangements. So what are the acid-base derangements? Either we can have metabolic, this is a metabolic cause, okay? Either we can lead to metabolic alkalosis, or else we can have metabolic acidosis. Then electrolyte derangements, right? It's because we are getting rid of a lot of ions within the gastric juice. So we will come across a lot of electrolyte abnormalities. And then other rare complications like biliary tear, esophageal rupture, and aspiration pneumonia. Okay. So these are the things actually we have to learn regarding vomiting. So we learned about what is the vomiting action, that is a reflex. We learned the mechanism, vomiting act, and we learned some causes, clinical importance, as well as briefly we discussed about the complications. So that is regarding vomiting. See you soon with another lecture. Thank you very much. Bye.